Tuesday, October 14th of the Budget Committee for the town of Bristol. Did I get that right? You'll correct me if I do anything. I'm really, for those of you who haven't met me before, we'll all introduce ourselves, but I'm pretty informal, so if I say something that doesn't make sense, I should really say it to my committee members. You guys all know, speak up. So before we get into that, the first thing we're going to do is stand up and do the Pledge of Allegiance. I'm going to ask Walter Waring to lead us in the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. I don't think, let's see if I have it handy. So I usually try to adjust the budget to take kind of the group with the most people early so people can get out of here and not have to spend a lot of time. But I think I recognize a lot of you from previous years, but I'm not clear on a count. So we'll just go through the list, if that makes sense, if someone wants something different. So alphabetically, I don't think we have anyone here from Bridge House or from Katy. If I'm wrong, please speak up. So alphabetically, CASA.
That's us.
If you guys could, at least one of you, or both of you, we can get another chair. Sit at the table. You got that because there's a microphone there.
Sure.
And as a first order of business, I'm going to ask you to both state your names so that we get it in our records so we can put it in the minutes.
Go
Go ahead.
My name is Stacy Lopes, Lopes.
Okay.
Sue Chadwick.
I recognize you from last year,
Yeah.
yes.
Yeah.
So before you get going, let me just, for everyone's benefit, we're not at this point making any formal motions. I'm not anticipating we're doing any votes. We're not approving anything tonight. This is the first meeting of the budget cycle for this year, and this is basically an informational session where we've invited all of the, what I call the outside agencies, the non-governmental agencies that are asking the town for support. What do you do to benefit the town of Bristol to justify why we should be sharing tax dollars with you? So for the most part, I'm asking you to sell your organization to us.
Wonderful.
So what I'd like to do is just start open-ended with you guys telling us whatever you think it is that you want to share. And then when you finish with that, we'll see if any of the committee members have any questions where they want more information or any clarification. So go ahead.
Okay, great. I'll start.
Yep.
Okay. Well, thank you for having us tonight, and also thank you for 15 years of support for CASA. If you don't know what CASA is, we are court-appointed special advocates, and we're a statewide organization of volunteers that stand up for children who are abused and neglected in the court system. And right now we have about over 600 volunteers in the whole state, and we represent each year we have about 1,500 children that we represent throughout the year, and that's only about 85% of all abuse and neglect cases that are in the state. So we're constantly looking for more advocates and more volunteers for our program. And right here in Bristol, we currently have 4 advocates, one right here with me who will tell you a little bit more, and we have 9 cases currently in Bristol specifically, and in Grafton County right now we have about 80 cases
Okay.
that we're working on.
So I've been here before. I'm an advocate. I'm a volunteer for the CASA organization, coming up on maybe 5 years with the group. And I've had 4 cases. I currently have like 2. We don't usually have more than 1 or 2 cases that we focus specifically on that child. And they're referred to us from DCYF when the case comes to their attention and children are removed from, most often removed from their parents because of abuse or neglect. There are a lot of drug-related cases, children born substance positive. There are also cases where the living conditions are terrible, or there's domestic violence, or other things. Every case is very different. I have a case right now where a young man, and usually it's hard to, every case, the goal is reunification with the parents, and over a 12-month cycle, and when that works, that's great, and I think about 40% of the cases, it happens successfully. Other cases, my case right now, the child, both parents are deceased, and the foster family wants to adopt him, which is wonderful. And he wants it's like the first loving, non-dysfunctional family he's ever been part of. And usually for someone to adopt a 16-year-old boy is not that frequent. And it's just so it's just a case that started with all sorts of not good things and ended, beautifully. And so I've been with that young man for a little over 2 years right now, and moving towards adoption. And so there are other cases, that I've had with babies that were born substance positive that recover enough. They're not seriously damaged, but then move to adoption, and some to reunification. Everything I do, I think the first time I was here, someone asked, how much do I get paid?
I remember you getting asked that
I get nothing. It's totally voluntary. So my hours, my mileage, my printer cartridge usage, everything is on a volunteer basis, as are all the CASAs. And the current 4 CASAs within Bristol are all wonderful, wonderful people that we often get together for support and other things. I don't know if there's anything else I can clarify.
Okay. Anyone on the committee have any questions that they have, or want additional information or clarification on anything? Go ahead.
Do you, when you're helping the children, is that at the circuit court level, or at the Superior Court level, or
It's
combination?
a family court.
Family court.
Yeah, and so they're family court judges. And I'll tell you, the family court judges in this state are amazingly wonderful, kind people who are on the side of the child, and the parents are working very hard to reunite and reunify a family, a good functional family. And when that doesn't happen, they're still, very helpful. And the CASAs, my role is just the advocacy of the child, because in the court process, the parents who have been cited by DCYF have court-appointed lawyers.
Sure.
But the children do not, and so the CASA advocates, represents the child, and so it's always the best interest of the child. That's my focus.
Thank you.
Anything else? No, it was great to see you again this year. Thank you for coming, and thank you
Yes.
for all you do for the people in the community who need help.
Yeah, and thank you.
Yeah, thank
for
you
your
very much for
support.
having us.
All right?
That's great. Thank you.
We'll move the chair.
You're welcome to stay, but I would expect you're not going to. So on the list, the next would be KOA, and I'm expecting there's no one here. Okay, just want to make sure if I'm wrong, somebody good. So next on the list is Grafton County Senior Citizens. So again, at least one of you, multiple can come up, but at least one of you come up to sit at the table with the microphone, introduce yourself and everyone else in the room who is here to support your organization. And I need to just say to the rest of the committee, so that you're aware, that from past years when this organization came, they invited anyone who was interested to go. There's one in Bristol in the Newfound area, there's Tuesday, once a week, there's a community lunch. I have started going. I have gotten involved. And at the meeting last month, I was elected president of the advisory council. So I just want to let you know that I am not completely neutral, and so you guys can know that. Go
Well,
ahead.
we're happy to be here too. Go ahead.
Thank you for that. So my name is Kathleen Vasconcelos. I'm the executive director of the Grafton County Senior Citizens Council. With me is Gail Emmonshaw, the director of the Plymouth Senior Center and the Senior Center right here in Bristol. Donna Fletcher, her second in command, first officer. And we brought other advisory council members. So do you want to go down the line and
Yep.
introduce
Starting
everyone?
from the right is Rosa, then Kathy, Lillian's not here, and Rose, all with us from the advisory council that
Shannon, do you need last names? You're all set. We need last names.
Yeah.
Rosa Ackerley. Why don't you go ahead with your own names? That way you'll pronounce it correctly. Go ahead, Kathy.
Catherine Gilpatrick. Louise Lacasse. Rose Williams.
We just want to list everyone in our minutes who's here from the public. That's why we're asking for your name.
Thank you.
So, so same thing. Why don't you go ahead and give us your point of view, and then if we have any questions, we'll ask them.
Okay. So our funding request this year is $10,000 from the town of Bristol, and that's the same as we requested last year. So thank you for considering that and for your past generosity. I'll give you an overview of the organization and then hand it off to Gail to talk about the local senior center and what's happening there. So we've been around for more than 50 years. We operate out of 10 locations, and the Bristol Senior Center is one of 8 senior centers that we operate around Grafton County. As of November 1st, we will have 7 senior centers and not 8. We are merging our Orford and Haverhill locations, and that is due to funding challenges. So we're facing those challenges and uncertainty like probably every other nonprofit in the room. So that's one of the things that we've decided to do to address that and to keep our services going. Our mission is to enrich the lives of older adults and individuals with disabilities by creating opportunities for engagement, fostering healthy aging, and delivering compassionate support. We offer services such as Meals on Wheels, congregate meals at the Senior Center. If you haven't, please go. Thank you, Paul, for going. We hope to see everyone there for a meal and activities and social interaction. We also have transportation. Our buses drive people door to door from their home to the Senior Center, to medical appointments, wherever they need to go. We have volunteer opportunities and assistance from outreach workers. Gail will get into all of that. So our services, we serve 215 from the community and another 18 through our Aging and Disability Resource Center. The $10,000 we're requesting represents 7% of the cost for us to provide services just for Bristol residents. And as probably everyone knows, because I probably say it every year, but New Hampshire has the second largest proportion of older adults in the country compared to other states, and we're the most rapidly aging state. So we know that the services we provide, they're much needed, and they're only going to become more in demand as that trend continues. So thank you again for your support, and I'll hand it over to Gail.
And as always, I want to thank you all for being here and supporting us, and for you guys to be all here too. It means a lot to all of us. We've attended here many years now, and your past and present generosity is always appreciated. So I also want to say that Grafton County Senior Citizens Council, with Kathleen's leadership, we're facing a lot of change and funding issues head on and making tough decisions and good choices, and I want to thank her for that. Thank you. And I admire the determination of our administrative team, who are based in Lebanon but are always within reach for us. So the Bristol United Church of Christ is our landlord, and they're gracious landlords, and they recognize these financial challenges, and they're working with us to help us transition out of the downstairs office. That will merge in with Plymouth. So the paperwork for Newfound will be in Plymouth. The phones will ring in Plymouth for us, but we're here on Tuesdays running the buses, having an outreach worker in the space, lots of volunteer activities. We have our meetings with our advisory board. There's all kinds of things going on. So we had a congregate luncheon today, and we have arts and crafts. We're making holiday earrings. We're doing all kinds of fun things. We also introduced today a program that I heard about, that I heard about on a TED Talk, and it's called Before I Die. And so in that case, in New Orleans, after Hurricane Katrina, a woman named Candy Chang, who is a community artist, was depressed. And so she painted the side of a building and said, "Before I die, I want to." And people overnight filled it up with their hopes and dreams. And so she's created this whole project now, which has gone, there are 5,000 walls and in 75 countries. So we put one up in Bristol today. So it's at the senior center. And we got about, what do you think, maybe 20 responses? Everybody wants to go to Alaska. I want to go to Martha's Vineyard. There's all kinds of things want to do. Seeing your family, being with loved ones was a prominent theme. So I think it was fun, and it's nice to engage our community that way. We get all kinds of interesting responses. Last Friday, my husband and I delivered about 20 home-delivered meals to the community, and we got a late start. And when we got to every door, they asked if we were okay, because we were late. And that kind of compassion just trickles down throughout this community, and I love it. So I want to encourage you, Paul, too, if you want to ride around on a home-delivered meal route, Donna's your woman. So this is the October newsletter. It has lots of things that are going on. You're welcome to check it out, ask any questions anytime. We want to thank you again. And as always, Newfound is mighty and pretty darn fierce. So do you have any questions or concerns? No? Thank you so much. Good to see you. I like that. So thank you very much.
So I was just gonna, I get the newsletter and saw that, I called it Lyme, it's the other one.
Orford.
Orford.
It's in that vicinity.
Because I thought, I was a little bit pleased, because to me, looking at the current 8, Newfound is one of the smaller ones. We knew that the council was having financial issues. They're giving up some space, they're reducing rent. I know someone in a leadership position at the BUCC. He explained to me that they recognize what the Senior Citizen Council is doing, considers it part of the service to the, they basically have agreed to really drop the cost. They're, in my opinion, they're subsidizing because they see the value of what these folks are doing. So I'm glad that you guys found a way. I was afraid that when you had to close a place that it was going to be Newfound. So I always wanted to just reach out and say thank you for, I think we do enough stuff that I'm glad you guys recognize that and found a way to keep us open.
Yeah.
The church, the leadership there, they've been fantastic to
They
work
have.
with, so understanding. So yeah, we appreciate that.
We do.
So I told you I wasn't neutral, so that's why I mentioned it.
Thank you, Paul. Very nice.
Anyone else, any comments or questions?
I just have a question. So how do you get the word out, to other elderly people in the area or older people in the area and stuff like that? If they don't attend the church or they don't go to the center or anything like that, how do you get the word out? Do you do Facebook? I mean, how is that in the paper? What do you do?
Yeah, I mean, we do use Facebook. A lot of it's word of mouth.
That's what I was gonna say.
Yeah, I mean, so much of it.
And
really-
referrals,
Okay.
for home delivered meals especially,
Yeah.
from the doctors or visiting.
So I was gonna say, we've hooked them up that they do send notes to Cade to go into the Bristol Buzz.
Yep.
Okay, that's.
We've got them together with Patty so
Yep.
that
The
the
library.
library supports
Correct.
the senior citizens, and the senior citizens tell the seniors what's going on at the library.
Right.
So I'm more about the communal meal, so I don't know as much about the home delivery.
Word
the
of
Meals
mouth
on
is
Wheels, but
a nice, works very well.
Mhm.
just continuing to do good work, as we all do. Also, thanks.
Anyone else? Thank you so much for coming.
Thank you, appreciate it. Thank you. Have a good evening.
All right,
Thank
you too. So, that was, and there, I don't think there's anyone here from Health First, correct? Okay. So next is Lakes Region Mental Health. Is there anyone?
That's
Yes.
me.
Okay, great.
I'm just gonna move my bag
Yep.
closer,
Feel free.
since the room cleared. Hello, I'm Beth Vashon. Maybe you recognize me from prior years. I'm the Chief Development and Public Relations Officer at Lakes Region Mental Health Center. We are a private nonprofit corporation celebrating our 60th anniversary this year, and one of 10 of the New Hampshire designated community mental health centers. Our catchment area is all of Belknap County and southern Grafton, including Bristol. In addition to the comprehensive integrated behavioral and physical health care services, which I included links in our application. I probably gave, in case you wanted to look them up and really had a lot of questions, I tend to give too much information, but I'll still have forgotten something. We're a committed leader in the effort to achieve Mission Zero, which is to eliminate emergency room boarding in our state. The last fiscal year, we opened a Place to Go in Plymouth, which is a short-term crisis stabilization center that is an alternative to emergency room mental health care and boarding. And our adult services team collaborated with the Belknap County Court to establish the Belknap County Behavioral Health Court. And you have one in Grafton, which is lovely, but we've been long waiting for one in Belknap. And our adult services team now manages that program and provides the services. That diverts low-risk individuals from the court system into appropriate treatment. We also opened our doors in Laconia 2 mornings a week for open access intake assessments for adults 18 years and older, and we hope this year that we're going to be able to expand that to our Plymouth office and to our child and family program. And all of those things were accomplished last year despite some workforce challenges that continue and a reduction in our workforce from 205 employees to 165. And that's of today, so I know that number's right. We provide services per our contract with the Department of Health and Human Services to anyone seeking health care regardless of their ability to pay or whether they become a patient in the future. For example, if a patient accesses services through rapid response or mobile crisis and our team goes to them wherever they are, they may or may not become a patient of Lakes Region Mental Health Center. And that is a community mental health center's purpose. And the terms of the contract with the state are to serve the most vulnerable, highest acuity, highest in need patients who need the highest levels of care. And those people are the furthest often from socioeconomic opportunity. They're of low income or disabled and therefore eligible for Medicaid and dependent on Medicaid to access vital care services, including transportation to and from their appointments. So our annual budget is comprised of about 70%, give or take each year, Medicaid reimbursements. Usually it's on the higher end. And the other 30% is dependent on private insurance, patient co-pays, self-pay, rare, and other sources of revenue, including town and county support, grants, donations, and fundraising. All of those are my job, that 30%. And there are high costs associated with staffing our 2 office locations and providing staffing 24 hours for our emergency services, a place to go and rapid response. And per our contract with the state, our services require oversight of our chief medical officer and child psychiatrist. Both are licensed medical doctors who can diagnose, provide therapy, and prescribe medication. We have several psychiatric mental health nurse practitioners and advanced practice registered nurses who have advanced degrees in psychiatry and often pharmacology, and they can also prescribe medications. I'm telling you this because we've had some questions that we don't have real medical doctors, but we are required to because we prescribe medications. And master's degree level therapists are required for many of our evidence-based treatments. And these are all proactive, preventative mental health services that, in the end, save taxpayer dollars compared to costly alternatives. We also we're in the third year, and thankfully we've received confirmation, although much of the federal government is on hold. We're in the third year of a grant through the Substance Abuse and Mental Health Services Administration that provides street outreach, including in Bristol, to people experiencing homelessness with co-occurring mental illness and substance misuse disorders. And we've been able to reach over 300 people in our entire catchment area since the beginning of that grant, and engage them in treatment, or they're in some stage of hopefully engaging into treatment. This year's request to Bristol is a little more, but we've done a recalculation based on need and the cost of the program, and it's for $8,716 to be exact. No round numbers. And it's based on the percentage of Bristol residents in our catchment area, which is about 3.5%, and this year's budget for access to care or open access, which is a little over $249,000. Last year we served 3,088 patients and provided over $826,000 in charity or uncompensated care to people who couldn't afford to pay for services. And that included 106 residents of Bristol, and we provided a little over $25,000 in charity care to Bristol residents that they couldn't afford to pay for. And now that we have a better system to collect data, from this point on, we will report patients served and also service hours, because that can give you some kind of clue as to the duration and complexity of services. Because, for example, if one child received 1 hour of services, that could indicate they accessed emergency services. But this year's numbers, we saw almost a 50% increase in the number of Bristol children who access services at Lakes Region Mental Health Center. So that's up to 37. Last year it was 19. Adults is kind of the same. It was 56 adults, 18 to 61 years old. And last year it was 61. And the exact same number for 62 years and over, 13 elders access services. That's about it. Do you have questions?
I have two questions, so
Sure.
I'll go first. You mentioned that your staff has shrunk. I think I remember hearing an ad on the radio where you were basically advertising, looking for professionals who would want to work there. Is the shrinkage due to the fact that your budget is so tight you can't afford them, or is the shrinkage due to the fact that you can't find people to hire to fill the empty positions?
It's a good
that you
question.
have?
I'm glad you asked it. Both is the answer.
Okay.
Last year's legislative session and this year's executive orders have caused a lot of uncertainty in the field, and unfortunately a lot of not just probably mental health but other nonprofits as well have they can't afford to have that kind of financial instability in their lives, so they resigned and took jobs which they could always get in the private sector that pay more. So there's that, and there's been a historical workforce shortage in mental health, which we are working diligently to rectify as a system. And then operating budget, I'm probably speaking for all the nonprofits, but is very difficult to predict this year. Rising costs sort of are hitting us, and our contracted service providers are having to pass their costs on and raise their rates, and utilities, and the cost of doing business and goods and services is just more in general. So those of us in leadership, we're kind of doing 3 or 4 jobs, sometimes more. Our chief operating officer resigned late last year in the spring, and the CEO took that responsibility over. We're currently looking for some key program positions, and our CEO is also doing those. But she's only one human, and we're spread a little thin. But I think we've achieved a lot, and we're chugging along, filling the gaps. So.
Okay. So my other question on a different subject is I think, I'm not gonna get numbers, so I'll just say, but you talked about that it sounded like there was a good number of people you talked about from Bristol who have accessed services, and then you talked about that there's more children. I guess I'm just curious, I'm blessed, I don't use your services, I don't have any real experience with them. Is most of that, I'm gonna say, self-referral, I know I need help, or is that like the guidance counselor at the school is contacting you to say this kid needs help, or I don't know, our welfare office is contacting you to say someone came in and is homeless and needs help, and they get referred? How do the people get into the system that you know they need help is kind of what I'm asking.
Well, for children, some of that is through the court system, through CASA, for example, or
Okay.
DCYF, or some of it is mandated, some of it is referred through schools. We do have on-site clinicians in some of the schools in our catchment area, which reduces barriers to care, being right there in-house. And incidentally, we don't get paid for a lot of that time, and we can't bill for a lot of that time for meetings, and services are reimbursable, but not that kind of time. But we know it's the best thing for kids, so we do a lot of that. And Bristol isn't unique. We are seeing an increase in the number of children treated pretty much across the board. There's a lot of trauma that has come out in recent years, and some of that is post-COVID, and I think people are becoming more aware of mental health services, and it's okay. The stigma is reducing, and knowing that early treatment is best and for long-term positive outcomes.
I'm laughing myself, I'm old enough, I remember Boys Don't Cry.
That was a song back in the day,
Oh,
right?
was it?
And incidentally, Bristol, of the Grafton County towns, has the highest utilization, just behind Plymouth. That was a question in my last budget meeting, so I thought you might be interested.
Okay. All right, let me stop. Anyone else? Yes, go
Yeah, I
ahead,
just have a
Sue.
question. So these are all Medicaid patients? I mean, or patients without insurance, or is a lot of this billed to the patient's insurance?
A lot is billed to patients' insurance. If you're interested in that exact breakdown, you can go to our website and look at our annual report, and
Okay.
we have a new one, and I know because I'm creating it, coming out very soon. And it gives you the exact numbers and the breakout. But that $826,000 number from last fiscal year that indicates people who didn't have insurance, whose insurance didn't cover mental health services, people who couldn't afford their co-pays. I think I covered the list there.
So if you broke it down, you'd be able to see with Bristol themselves, how many, like you said, you serviced 100 and some odd for Bristol?
Yes, and I could tell you exactly how much charity care was provided for each
Yeah.
age group.
Right, okay,
But it was a little, altogether, it was over $25,000,
okay, gotcha.
which was an increase, but honestly, from last year, but honestly, the data wasn't that good last year, but I trust this year's data. We were changing systems, so it's better this year.
Brian, go ahead.
When You talk about the children patients in Bristol. What age group is that?
That's 0 up through 18, and sometimes children with disabilities up to 21 can be served in our child and family program.
Just one other question. After they're receiving your services and you're assisting them, generally how long are they sort of in your program?
Depends on the treatment. Average treatment just is around 12 weeks, but it depends, again, on each individual patient and their needs.
So it's not,
And
it's not years, it's
some we do see for years.
okay.
But again, that the service hours number can provide you with more clues about the duration of treatment. So children 0 to 17 last year, it was about 8.5 hours average per patient. But of course, that's just a flat average, yeah.
Getting a sense of how long your services are directed towards that population.
It seems like children have more short-term services, but that is because, too, we're fortunate to receive a lot of grant funding for training for evidence-based practices for our child and family team. And by combining them, we have seen the proof that it's shortening their treatment duration, which is a really good thing to see.
That's good.
Yeah.
Thank you.
Go ahead, Buzz.
You mentioned that you identify and try and steer into treatment homeless substance abusers.
Yes.
Assuming they are successful in the treatment, how do you address the homelessness?
That is a very good question. We have some residential programs. We also have we operate the Belknap County Warming Center. Unfortunately, we get people signed up once they're able in the list for available housing, but that list can go from 2 to 5 years because there just isn't any. We were partnering with Lakes Region community developers to increase housing for people who need 24-hour support, the chronically homeless who need some mental or behavioral health supports. So we opened Bay Street Housing a little over a year ago. That is 12-unit building. We operate Passage House in Laconia. That is a 24-hour supported living facility, but that's more for severe mental illness and less for homelessness. I wish we had more options, but we do provide resources and get people into treatment.
Anyone else? Thank you very much.
Great.
Are you okay? Do you need more data? Did you want to look it up? Did you want to ask her to email?
Oh, yeah, could you, yeah, sorry, yeah, I do want to look it up, I just was gonna look it up. I thought you said to go to the
Instead of
site.
sending her to your website to search around to look for that, is
Yeah.
that something
Yeah,
you're
I can
comfortable
email.
sending an
Yeah,
email
sure.
to the same, send it to the same email that you got the request from, and Shannon will distribute it to the
Absolutely,
committee?
I'll send you that breakout. I have
That
to do
would
it
be
anyway
wonderful.
for my annual report, so it'll be a twofer.
Thank you so much.
Thank you.
Have a good night, thank you. Okay, so next is Lakes Region Planning Commission. Not at this time. Okay, we'll skip them and see if we can come back. Lakes Region Visiting Nurse?
Yes, sir.
To go back with Lakes Region Planning Commission, I think we might be here closer to 7.
I understand, because
they're-
yes, he's, at least one of those people is also in another group, I
Yes.
understand that. But, I'm sorry, I'm going down the list. They're
Yeah, no,
next.
I just wanted to let you know.
Pull up a chair.
Okay, let's see. Okay, I'll finish and then you can.
I'm delighted to stand for Lakes Region.
Okay. Wonderful.
Hello, everyone. I'm Dr. Erin Josby. I have the privilege of serving as the Chief Executive Officer at the Lakes Region VNA, and my colleague.
Yeah, hi, Jim Harnett. I'm a CFO for the Lakes Region. Been there over 7 months. It's a wonderful place.
We're very lucky to have
Since
him.
he's here with you, if you could just
And
get him into the
Walter,
record, we all
yes.
know Walter.
I'm Walter Waring, I think most of you know me. I can't think of a better way to say how much I appreciate Dr. Aaron, Meredith, and Casey for the services they provide for my wife. They make my life a lot easier. I want to tell you, there's other people in this neighborhood who receive services from Lakes Region that push me on daily to stand up for them. There's a couple who are treated by Lakes Region, and you've known I've spoken for them for a long
I
time.
know, I just want to mention, please be careful
There-
not to mention any names in
I
a public
won't.
meeting. Thank you.
They're in their late 90s, and his wife is in her mid-90s. And life wouldn't be possible for either one of them without Dr. Aaron and Casey and Meredith. The needs of the seniors and the children in this community cannot be looked upon as an expense. The money you pay for these services saves the town money, because if you don't handle those needs in an intelligent, organized, capable manner, then you're going to have it handled by emergency services. That's inefficient, destructive, and it does none of us any good. Let's handle it well. It hurts. It hurts when you see the needs that some people go through. It also feels awful good when you see three little children that you've seen beaten in the past and their mother march their way to school, and I don't mind standing up anywheres to represent them. Please support the needs of the children and the seniors in this community. It's a savings for the town to do so. And I want to thank you for giving me the chance to speak. I do have one more thing I want to say tonight before it's over. But I want to say that after it
Let's let them.
only partially pertains to this.
Okay.
That's a really tough act to follow. Thank you very much for your kind words. It's a privilege to work for Lakes Region VNA and the way that it has been a part of the Lakes Region communities for now more than 100 years. The services that we provide range from patients that are newborns all the way through the very elderly. We provide rehab, speech, we provide occupational therapy, we provide home care in both skilled nursing and private duty, and of course our hospice services as well. Our commitment is always to provide care regardless of a patient's ability to pay. And so when we ask you for funding, it is that extension of our services regardless of our reimbursement that you are committing to. We also use those funds for education. It's really important that we provide the very finest of care that we can. And as we all know, the pace of medicine is beyond accelerated. And so we always want to be continuing to invest in the professional development of our staff so that we can continue to provide the very highest of quality of care. Likewise, we provide scholarships to graduating high school seniors who are looking to pursue careers in the clinical sciences, which is another way that we hope to give back into the community. And our friends at the Senior Center, goodness knows, we really are committed to community wellness and the idea of how we can help people successfully age in place. Certainly health outcomes, time and time again, are proven to be superior when people are granted the dignity and respect to receive treatment in their homes. That is our philosophy, and it is incredibly rewarding to see it come to fruition day in and day out, and to help our staff be able to provide those services. The other thing I'll say is, with all humility, is unfortunately there are more than enough sick patients to go around. As people struggle to age successfully in place, as people struggle with their health insurance, the challenges of receiving care within the brick and mortar of a health system. Going into the home is really where we see people be most successful, and that is something that we remain, again, incredibly committed to. We all have things that will be differentiators for us as organizations that look to provide those cares, whether it's ACASA, whether it's my colleagues at Pemmy Baker or Franklin. We're all committed in much the same way. And though, again, I believe there are things that differentiate us, and in our case, we are the only 5-star rated CMS organization that provides hospice care in this area. We're very proud of that. But that doesn't mean that all of these agencies are not doing tremendously good work, and we're very humbled to be considered for the receipt of funding support. I'll hand it over to you, Jim, to speak to some of the financial details.
Thank you much. Thank you. Thank everyone here. So Lakes Region Visiting Nurse Association, we respectfully request a town appropriation of $33,400 for the 26 calendar year to support our essential home-based healthcare services for Bristol residents. This represents 0.5% of our total operating budget, and is equal value to our request from prior year. Your continued support enables us to meet the growing need for home-based care, even as federal Medicare and Medicaid reimbursements will continue to decline. We are deeply grateful for your past generosity and respectfully ask for your partnership once again in 2026, so that every resident, regardless of financial means, can access compassionate and professional care in the comfort of their home. We're proud to have Bristol in our service area, not only because of the families that we serve, but because we have 7 of our very dedicated staff members that reside in this community. Over the past year, LRVNA, we've made almost 2,100 home visits to 104 individual Bristol residents. In addition to home care, LRVNA continues to offer free wellness events at the Bristol Senior Center, including our popular weekly chair yoga class and our monthly blood pressure clinics. This fall, we are pleased to host a community flu clinic on October 21st, also at the Senior Center. Looking ahead into November, we'll offer a free bereavement support group at the Minot Sleeper Library, open to all who are currently experiencing loss. We remain steadfast in our mission to provide compassionate, high-quality home care and hospice services to all individuals, again, regardless of their financial circumstances. Your continued support helps make this possible, and we are deeply grateful for the trust you place in us to care for your community. Thank you.
Thank you.
Do folks have any questions?
That's what I was just looking around at. Go ahead, Scott.
So I've heard that the Bristol office is closing. I didn't know if you could share some reasoning on why and what the plans are moving forward.
Sure.
Staff will check in or...
Yeah. So the beauty of home care is that it's truly a distributed workforce. So our main office building in Meredith, of course, continues to go on and is sort of the main supply hub, and it's where our administrative offices are focused. Our office in Bristol has been used by those staff that are serving this area for supply check-ins, and we're committed to making sure that we do whatever it takes to make sure patients get all the supplies that they need at no extra effort on the part of our staff. Our commitment is to continue to use the building until such time that it's sold.
Okay.
So we're not looking to create an eyesore.
Right.
We're very much there. But again, because the staff are in the homes and they're not really coming into the office, we don't feel that it is a cost that is giving much back to the staff. And because patients don't come into those facilities anymore, it's not hurting the community that way either. So we have really enjoyed the opportunity to work with folks like the senior center, the library, think about where people are already congregating to come and bring our wellness activities there. As Jim alluded to, our movement class at the senior center is super popular. Where else can we continue to explore that? But we remain very receptive to, where is it that our community members want us to be, and how can we continue to fulfill that need that way? Jim, was there anything else that you?
No, again, it's, the space is a resource that we don't feel is being utilized to its full capabilities. We feel a sale of that will provide some extra funding that we, quite frankly, could use that'll help, contribute to the wellness events that we do have planned and to create more and have our folks, spread out further in our whole catchment area.
But again, our commitment to the Bristol area is not incumbent on any one physical space. We serve over 44 towns?
Correct, yep.
44 towns, and it is independent of a physical space. But again, it is important to us that you know that we are committed to making sure that it stays nice, that we continue to use it to bring what traffic we can to the area, and hopefully find a buyer that can level that experience.
Sure, and to your point, this has been a very deliberative process. I think we probably talked about it in March. And by the time we had a firm sort of strategy, it was 3 months. And it's been on the market now, I want to say about 2 or 3 months. And we're being very deliberative on who gets to look at it and what kind of offers we're going to accept. So, we certainly have the town in mind, as we're going through it.
How many offices are located in the building, roughly? Like rooms or office space?
Oh, gosh. I think it could be pretty flexible, but if I'm counting, 1, 2, 3, 4. There's a kitchen, there's a conference room. I want to say there are 4 to 5
4 to 5 office spaces, and then there's a large room, probably, I don't know, maybe.
A waiting area.
Yeah, a large sort of break room that could be broken out into some other cubicle space.
And a basement that could use some love.
But we look at the space, and it would be perfect professional space for an accountant and an attorney to split, or, a dental office, daycare.
SAU office?
Yes.
But there's no,
Absolutely.
it's not exam room space right now.
That's interesting. Yeah.
Come on, Doc. Thank you for the question. Did I?
That answered
Okay.
that.
Buzz, go ahead.
I noticed in your letter that you list 18 chaplain visits. Is that done on a contract basis or volunteer?
No, so we have a chaplain
Ah.
who works for us, David Poole. He's wonderful, and we're real lucky to have him.
Yeah.
He's new to this area, and he's already just becoming a real presence, and we appreciate the compassionate care that he has provided. His main go-to is, of course, the support of the hospice patients, but he's been out and about in the community. He writes a column
Wonderful,
now.
yeah,
in the
wonderful
paper.
representative
He's
for
really
what we do.
lovely.
Yeah.
We do have volunteers, however. So an interesting fact around the compliance of having a hospice agency is that 5% of your hospice costs must be provided essentially by volunteer activity. So that kind of, people turned a blind eye to it during the height of the COVID years, but we have now reattained that level. And we're really grateful for the types of volunteers that this attracts. It's hard work for even the most seasoned of people. And yet I think they're incredibly special. We have a lot of retired healthcare workers who come to provide volunteer services, and they go into both facilities as well as people's homes.
Go ahead, Brian.
Just to go back to follow, is the property on the market with a realtor?
Yes. right now with Lake Life, is that?
Lake Life Realty, they're out of Molten Borough.
Okay, good, thank you.
Yes, so we purposely asked for no shingle, it's all online, the listings and such. Realtors and anyone looking for a commercial space will have easy access to find our listing, but we didn't want to put out a shingle.
Understand.
And, you know, we respect the fact that our agency has evolved over time. Nana was very much a presence here in the Bristol area, and I want to say it was 4 years ago that Nana
Correct, yeah.
merged with LRVNA. I like to think that we're greater than the sum of our parts, and we've taken the very best parts, like the scholarship program was something that absolutely traces its heritage back to Nana. And so we know that the building, people have affection for it, but please know that we continue to evolve and ensure that all of those services will continue to be provided, just in different ways.
I have a couple questions. I didn't get this out to you in time for when you sent the paperwork in, but it says here you've seen a total of 2,094 home visits for Bristol residents. That could be multiple visits for like one individual or two individuals, all those, they're not separate patients. They're
No.
multiple
We have
visits.
one, I didn't have break it in your letter, but
Yeah.
I mentioned it, so it'll be in the minutes. We have 104 Bristol residents that we've seen.
104.
Correct.
So 104 unique patients
Yeah.
have generated over 2,000 visits.
Okay, gotcha. And so out of those 104, how many of those patients did you see that did not have any insurance or just Medicare?
So we do 10% of our, I think our annual spend would be, for Bristol, I know we did $60,000 in charity as an organization. I would say from a percentage standpoint, easy to say $6,000 or $7,000 was from this area, just based on the percentages.
6,000 or 7,000?
Correct.
Okay, and so the rest all had insurance, secondary insurance?
Yes.
Or whatever it is?
Correct.
Yes,
Okay.
we don't calculate out where insurance falls short. So, which is becoming a bigger issue because the reimbursement rates continue to go down. Your quick dive into reimbursable home care is that currently CMS has the power to reduce home care reimbursement by approximately 30%, according to what the New Hampshire Alliance has relayed to us.
But you're just talking about just Medicare though, not their secondary insurance?
Correct,
Okay.
just
Exactly.
from CMS, but the majority of our patients are Medicare or Medicare
Yes,
Advantage.
60%.
Advantage, that's what I was asking.
Yeah.
So you can put that into writing or whatever it is so I can see the numbers? Could you say, like,
Yeah.
what's the
Oh, sure.
breakdown?
Yeah. We
Yeah,
can
of course.
absolutely get
Yeah.
that for you. But
Yeah.
we are dealing with reimbursement rates like everybody is experiencing. They're just going down.
Yeah.
And
But usually
so,
what Medicare doesn't cover, your secondary advantage will usually cover the rest.
we can get you those numbers. There's
Yeah.
there's a big shortfall.
That's what I want to see.
Yes, there's a
Absolutely.
substantive shortfall
Yeah.
for home care, and I'm sure that our colleagues will also relay the same kind of experience.
Yeah.
So it takes some creativity. It also creates a real impetus to ensure that for your value-based purchasing, which has to do with the reimbursement rate that you can achieve by meeting certain quality goals,
Yeah.
that we are all focused on always already ensuring that we are meeting those goals every which way we can.
Right, okay, yeah.
I just will take the opportunity to point out that usually we lean on Joe, who is he's a committee member who's not here, he's out sick tonight, but if you know him, he's actually the CFO at Spear, so he's our expert. But just from regular general news, we know that a bunch of companies are stopping to offer the Medicare Advantage. They're abandoning the market because the rates have dropped, reimbursement rates have dropped so much that they no longer think that it's profitable for them. So,
Right.
but to the same point, I think this is a big industry-wide problem. Bristol doesn't have enough muscle to solve that.
We appreciate the efforts, but no, I think it's going to take creativity, and it's why aging in place and those kind of investments in making sure that people have the the resources, the access that they need, that they feel supported by the home care that they have, and working in partnership with their providers to keep people as healthy and well as we can is really the collective commitment that we all have.
If we can keep them healthy, and then they're happier and it costs less money.
Yes,
That's
yes.
exactly right.
Well, preventative, right? Preventative
Yes,
care.
preventing.
Yeah.
I mean, I'm a primary care doctor.
Right.
That's what we
Exactly.
try and do.
Yeah.
But-
Okay. Anyone else, question or comment? So before I let you leave, did you want to come back later in the night, or do you have something else you wanted to say right now?
I heard it start a minute ago, and I don't mind continuing it right now. I don't know how Nana got that building. I know I've been contributing to Nana as long as I can remember it. I know my father and mother contributed to it. I know my Uncle Chick and my Aunt Claire contributed to it. That building was important to us then, and it's important to us now that know what it was. Don't quietly allow it to be taken away from us. Keep it. We lost the fire station. I thank Scott for fighting for it. But I'll tell you what, we lost the fire station to a business after we bought and paid for it. We paid for that building, we maintained it, we took care of it, we supported it because it was important to us. I've been around and I've paid it a long time. Don't lose that building to some accounting office. Keep it for the people in this town that are paid for it and need it. Thank you.
Okay. Did you want to say anything after that, or are you all done?
No, I understand where Walter's coming from and respect his opinion.
Okay, thank you. I think that's great. Thank you for coming tonight.
Thank you. And I'll get those stats to you tomorrow.
Great.
Yeah.
Yep,
Good.
perfect.
Thank you.
Thank
Thank you.
Thank you. Thank you, guys. My life would be miserable if it weren't for Casey and Aaron. Thank you.
Alrighty, I was worried that we were ahead of schedule, but it's 7 o'clock, so we're ready to go from the 6 o'clock group of people to the 7 o'clock group of people. So next up is NLRA. So I think you came in after so what we want you to do is state your name so that we have it in the record for our minutes. And then we basically want you to have an opportunity to explain, basically sell to us. And then if we have any questions or want to make comments or clarifications, we'll ask.
Thanks, Paul. My name is Audrey West. I'm the Development Director for the Newfound Lake Region Association. This year we are asking the town of Bristol for $2,250, which is the same as our request last year. Our mission is to protect Newfound Lake and its watershed. Newfound Lake is an economic driver for the town of Bristol as well as the region. And it also has incredible benefits for the well-being of the people who live here, who work here, who play here. What we do is try to protect that. So the funding from the town of Bristol goes to our invasive species management and protection initiatives. It goes to stormwater management projects throughout the watershed, including in the town of Bristol. It goes to education programs. We strongly believe that connecting people with the natural resources that we're trying to protect is the best way to ensure that Newfound Lake remains clean and clear into the future. Because when people connect with the environment, they see the importance of protecting it and their connections to it. We work in the local schools. We work with the Tapley Thompson Community Center. And we now have a beautiful conservation center located in Hebron. The programs held there are open and free to anyone within the watershed or visiting the watershed. And I hope you all come and join us at some of our programs now that we have this beautiful space, which will only expand and increase our ability to run programs, from the water quality lab to more education space, to being able to do more interpretive education, it's going to benefit all of the region. I'd love to take questions.
So, I'm just, Scott, did you get the answer already?
Yes,
or do you
already
all
got
set?
it.
Good.
Yeah. Just the use of what the money goes towards
Yep.
specifically.
Mhm.
It came up in a select board discussion earlier today, and Scott and I said we would follow up and get that information, but you gave it to us before we even asked for it, so thank you.
Yeah, it goes to our general operations. All of our programs benefit from the support from the town.
Okay. Anyone else have a question? Brian?
No,
Oh, all set. I think-
Congratulations on the new
Thank you,
building.
thank
That's
you.
awesome.
Yes. Yeah, we're already seeing increased field trips, increased visitors. Our water quality lab we have new volunteers working in our water quality lab, and all of this means that the future of Newfound is cleaner and clearer. So, it was a community-driven project. It was community-supported. So thank you to everyone who was a part of that process.
I think you guys are an important part of the community. We enjoy working with you, and thank you for all your efforts.
Thank you for all you do.
All right, have a good night. So, next up would be the Passaquoddy Garden Club.
Thank you very much for this opportunity. My name is Barbara Carpenter. I'm the president of the Passaquoddy Garden Club. And we've been here a number of times, and we have just about the same information to repeat. We are a 501c3 nonprofit, and we are requesting the same amount that we've requested since 2023, which is $2,760, which goes to the plants that we provide in the barrels around town, for the hanging baskets that we deliver to the town for maintenance, for plants at the intersections of Route 104 and 3A, and for some sidewalk area in the bank area which the DDC takes care of. We have in the past requested $760 for removal of knotweed. We're having quite a time with that. I put in several calls, but we have not been having any action on that. But we've trimmed back as much as we can because it invades very quickly.
Nasty plant.
Yeah. And we don't have to annually purchase wood chips for the pathway and then mulch for the garden area, but when we do, it costs about $760, and some of our deliverers have been very generous about that and some not. We are a volunteer group that we purchase the plants, we plan what we're going to plant and where we're going to plant them, and our volunteer hours can exceed 1,000 hours, and that's a lot of weeding and traveling around just to pick up wreaths and pick up plants, and we have work days as well as meetings. The benefits to the town, I think, have been really obvious. I think Bristol looks wonderful these days. The plantings are so key. And we even had an adjacent town, I don't know if I reported this, but we in this town had a lot to do with Hebron taking a look at their common. And they've done a lot of planting and a lot of landscape work. I mean, it's a pristine New England setting, but they've added some plantings to it. So this that we provide is a service to enhance the beauty of the town. It's positive for visitors and residents. It's positive for the businesses in this area. And we promote interaction between organizations, the school and the town, and community engagement as well. There's one project that I would like to thank a number of people that work for the town that have been so beneficial to a new project we have taken on, which is the intersection of Mayhew Turnpike or Route 3A and the West Shore Road. That was an area which was very flat, that was owned by the state DOT, and the town owned the signage there. And I have to say, I really never paid attention to the sign or that spot. And it I was approached because we have our logo up there on that sign, to try to beautify the area. Would I be interested in? I was so all over that. We all came together. Within 2 weeks, we had the town DOT, we had the state DOT, we had the town of Bristol, and I have to mention some people here to thank. Christina Goodwin, who was, are you Christina? I'm so glad.
That's all right, we talked plenty of times on the phone.
It's so nice to see you. Well, Christina, I was all ready to get someone to design a sign. Christina was already on it. It was so wonderful. She ran a competition. The artist did a beautiful job and captured Welcome to Newfound Lake with a sunset view and a loon. And when I saw that sign about to be installed, she was there. And it was just happenstance we were driving by. And now I just couldn't wait to tell her what we were going to do. We were going to do a design which took away the flatness of that area. We did 2 berms and planted them. But it's to be maintenance free as much as we can. They are New England, not New England, but New England and New Hampshire native plants that we have planted, and we will continue planting in the spring. But if you've not seen that area, I think you will see it quite improved. We're very thankful for Christina's help in that, for Victor Greenwood, for Ashley Burrell, for Patty Haywood. These people all help our garden club in many ways that maybe you don't even know. So thank you very much for this opportunity to speak. And if you have any questions, I would be happy to answer them.
I was just going to say thank you back to you,
Yeah,
because you
thank
do
you
a
very
lot of
much.
work. You and your organization do a lot of work to help Bristol look even better. So, but does anyone else want to ask a question or share some praise?
Seeing that, I live up off of Hobart, and seeing what you did down there by the sign is incredible. It's just beautiful, and everything you do for the town. We're so lucky.
Thank you so much.
That way.
It's a gift to everybody.
All right. Any other comments, questions?
The only comment is, it's just kind of an odd number. I like big round numbers. I wouldn't mind round numbers. Maybe even 3, but
You know,
is that enough? Is that really truly enough?
What we do is we have a plant sale, and we dig up plants from our own gardens and from that garden, and we have been gifted, we were gifted some funds to do this project at the intersection, and it was a local LLC. It was so marvelous. We met for an hour, and we were just, excited and chattering. So the fact is, it is enough.
Okay.
Well,
Thank you very much to the garden club. There's nothing makes anybody from this town any prouder than the job you've done.
Thank you so much. That's wonderful to hear.
Christina?
I just wanted to say we were so very excited that the state let them do this, because we've been
Right, it's a
complaining
state
about
right of
that
way.
intersection forever. So-
Can I tell you a funny thing? We were told that this was to be given to another group that was just in here, I believe, and they said, no, it's too big, it's too much to take care of. And they had provided some limitations of what could happen there. And the limitation was nothing above 12 inches. I asked if I could meet to the superintendent of the state of DOT. And when I went there earlier, because it's all about safety, it's a huge intersection, but to explain to him that we were so far back from any visual impact. And when he first came there, I said, "Excuse me, sir, but do you see this dead dandelion?" I said, "That is 12 inches. I want everything I want." Thank you so much.
Thank you for coming. Have a great evening. Okay. Good. So, we'll go back to, that one's Garden Club. So Penny Baker, Hospice and Home Health. Is anyone here?
She's on Zoom.
Oh, we got a Zoom.
We
Okay.
got Theo.
Yep, go ahead. Let's, wait a second. Do you want to leave the thing? Okay.
Yep, we're good.
So again, if you would introduce yourself and anyone else, if there's more than one person calling in, and then go ahead and start talking.
It's just me today from Pemmy Baker Hospice and Home Health. I'm Aubrey Engel. I'm the Executive Director for the agency. And we are this year requesting $8,044 to help fund our free community programming that the Bristol residents have access to, as well as our caregiver support groups and bereavement support groups. We also offer Pemmy Baker Ask a Nurse at 4 senior centers in Grafton County, as well as advanced directive workshops. And the funds also go to help pay for wound care supplies and other medical supplies, as well as meet costs for our uninsured and underinsured residents of Bristol. We've been providing care in Grafton County since 1967. We provide both hospice and home health services, very much like Lakes Region VNA. Whether a patient is returning from the hospital, whether they've had a stay at a skilled nursing facility, or their doctor is requesting that we provide services, we take them regardless of their ability to pay. We provide care for patients from birth until end of life. We have on staff licensed nurses, nursing assistants, physical therapy, occupational therapy, speech therapy, as well as a chaplain, a hospice medical director, and social workers to help meet the needs of the patients that we provide care for. In 2024, we provided care to 32 residents of Bristol. 4 of those were hospice patients, and 28 of those were home care patients. We supplied a total of 574 visits to those 32 patients, and our clinicians drove over 7,000 miles providing that care. Just this year, we started doing a greater effort of doing more community education, educating patients and doctors' offices, folks at the senior center, Plymouth Senior Center, about aging well. We've educated about our home health and hospice services, and we're just looking forward to continuing to provide care. We find that we're providing care to a larger number of patients in Bristol every year.
Okay, thank you. Anyone on the committee have a comment or a question? Thank you for all you do. Walter, you want to make a comment? I'll go ahead and let you do that.
On behalf of a woman who lost her son, she asked me to thank you for Chaplain Guy and his grief care class. And I want you to know there are those of us in this town that know what Pemmy Baker can do to help. Thank you.
Appreciate it. Guy is wonderful.
Okay, thank you very much. If we don't have any questions, we'll let you go on and enjoy the rest of your evening. Thank you for calling in.
Thank you.
All right. So, next on the list is Lakes Region Planning Commission, or PRELAC.
Oh, you will. All right, do you want to come up?
Sure. Yeah, drag another chair up.
Plug out while, Mr. Chair, while they're getting comfortable.
Yeah, go ahead.
We have open seats. Anybody interested in serving on the Pemmy River Local Advisory Committee? I believe there are 3 open seats for the town of Bristol. We've been advertising it if anybody's interested. So.
That's you stole our fun. Thank you very much.
So if any member of the public is watching this,
yes,
please contact the town office and let us know you're interested.
Yes, please. Thank you.
Thank you.
And I also brought some information that you can pass out to people or look among yourselves about
Thank
what.
you.
And I'm not certain what
I can do that if
information.
you want.
Yeah, well, this is actually about an article about Max Stamp.
Okay.
It was the last,
It's called PRELAC.
article that Myrtle
Let me
wrote.
see, just the Penny Region Lakes
Thank you.
Advisory Committee. So before you start again, if I could get you to introduce yourselves so that we get your name spelled correctly in our minutes. We want to get all the members of the public here tonight into the minutes so that we recognize that you are taking the time to come talk to us.
All right, I'm Bill Bolton, long-term PERLAC member, but not as long as this guy.
Also passed.
Yeah, past chair, past
Chair.
vice chair.
Yeah.
I don't think I'm anything now.
And I'm Barry Draper, I'm from New Hampton, and I'm just a long-time PEMI member. I've been fighting for the river for a long time. I have a cohort who isn't really on the PEMI committee, but
I should be.
she does an awful lot. We work very hard to fight Northern Pass, and we put an awful lot of time into that. And we're very happy that it works. But now we're into trying to save the water quality.
So before you start your spiel, if I could get your name.
Yeah, my name's Gretchen Draper.
Okay.
I'm also from New Hampton, and I consider myself a consultant. Caretaker.
Okay, so before we ask any questions, I just want to open it up and give you guys an opportunity to explain kind of what you're doing.
I can throw out what I was doing, but it looks like you got.
I was just going to say that we are the Pemigewasset River Local Advisory Committee, and we work very hard on keeping the water quality right up to standard. We've been doing it since 1992. It was actually 91. It was actually claimed a designated river, and I wasn't on it back then, but almost on it. And it's just been, I don't know if people remember how bad it was. I mean, the PEMI was really a sad state of affairs, and it's just gone up. We're trying to keep the quality there. The development up north is getting more and more, and the amount of water that's being taken from the PEMI is another problem. So we do the water testing to test for the turbidity, the pH, dissolved oxygen, anything else, E. coli.
Yeah.
And we also we do site visits when the Department of Environmental Services calls on us. They have questions. They have, I'm trying to think of a positive way of saying, they don't have as many people working for them as they used to.
So they rely on you to carry some of that load.
We do, yep.
We're the boots on the ground.
Right. And what else do we do besides that? We, water testing that.
Well, we have a management plan.
Oh, that's the big, yep.
And the management plan has been updated in 2024, and that sets the goals. And you may have received a survey, because we survey all the towns that are involved in this. And we're just let's see, we cover from like Thornton and Captain down to Franklin. That's ours. And there's, looking at the size of communities, Bristol's actually like the third largest community out of everybody that we cover. The whole river corridor from Franconia down to Franklin is covered by different areas. So it's a big operation run by volunteers. We work with the Lakes Region Planning Commission, and of course the state New Hampshire Department of Environmental Services oversees. And they're the ones that, when someone wants to do something on the river that's outside of the sort of the legal rules, they'll ask for a permit, an exception, and that immediately comes down to us. And that's, we make recommendations. We don't say yay or nay, they do that.
Okay, I was going to ask that. Do you guys make the decision, or do you make a recommendation?
Just a recommendation.
Yeah.
You're the experts, but not the decision makers.
Yeah.
And did you mention it's a quarter mile on each side of the river? You know, any project that goes on within a quarter mile, we are called in to take a look.
And there are some crazy questions that are whether or not we can put a large dock that goes perpendicular to the flow of the river is, when it goes out too far, it's not going to stay there very long.
Right.
But there are lots of questions, and we try to answer them in a positive way, and then DES comes out and inspects after our.
And then you follow through too,
Yeah.
follow through on projects.
Right.
There's two other ones. There's a big grant coming through that's going to be part of us, which is the, well, you can talk about that. It's an inflow?
Do you want to do it?
Yeah.
No, you mentioned before. So, well, DES is very interested in establishing the inflow of the stream, of the river. But their focus is primarily on like trout and, you know, animals in the water. And what they do is they're going to define a baseline of what is taken out of the river all the way down the line. And just at that point, we'll know if someone like perhaps the golf course would want to take a lot more water out. There would be a rationale of saying, well, downriver, you know, we're going to lose a trout stream or something. So, but they started, I think, last July, and it's going to be completed sometime maybe in the next year.
Next year.
So at that point, it'll be another tool to be able to.
But it also establishes that baseline as to whether or not, you know, the water is warming or the flow has decreased so much that the cold water fish can't live there anymore. And this man, I forget, I don't remember his name. It's the man who walked the whole length of the Pemmy. And first he looked it all over, figured out what he was going to need to do to decide, and then he did all this testing. He has students and hired a bunch of other people, but that's one. And then there's another new program that I can't wait to see. It's a GIS story map of the Pemmy. And it's done with, I mean, the technology is, it's way over my head. I can't even explain, but the gentleman who's doing is named Jeff Delaney. It's his senior project up at Plymouth State. And it's just like, I mean, you'll be able to drag your cursor over the river and it will have dates so that you can see how that section of the river has changed in 20 years. And it's just like, and it has water temperature. What else does it have? It's just.
He said he'll put anything in there. You describe it, he'll put it on. So.
And
we'll see.
I mean, if it's going to make watching the changes of the Pemmy and seeing the past. I mean, I wanted to put up. I've got a great picture of Ayers Island Dam being built.
Oh, really?
And it's to see. It's all these men with wood.
It's shovels.
I don't know, did that come out?
Yes, it is in there, yeah.
Is it in here?
I don't know, did you say that actually what we come to ask for is $350?
Yeah, right.
Yeah, we weren't here just to tell you a story.
Now, the $350 goes towards, it's an all-volunteer group, but we pay for consultants like from the Lakes Region Planning. And supplies for water testing. And that covers it. I mean, each of the towns along the Pemmy are asked for the same amount.
I think we started out at 200 like years ago, and finally crept up down to 350.
Yeah. But 350 is also what we asked for last year, and
right.
So we're trying to be as careful as we can.
Do you have any questions?
I was just going to look around. Go ahead, Buzz.
How do you interact with the Corps of Engineers?
Not well. I'm sorry, I'm so honest. Our most recent one was we tried working very hard trying to get
Mooney Point?
No, or Agent, what's the Roundup from not being used there in spring around the edges of it, and they say that's just what we do. So but I mean, basically they're great we can talk with them, so that is good. But I wish we could be a little bit more environmental. They're more involved in keeping, it's good that they want to keep it the way it is, but they also want to harvest a lot of timber and I don't know, we're doing okay with them.
Weren't they kind of like difficult with the river path? I think the Army Corps had an influence on that, and that's why it's, you know, has really kind of.
I think that's why Buzz asked. He's
Yeah.
I'm chairman of the committee.
So how are you dealing with it?
Well, no, I was more concerned just because you mentioned that you were involved, you cited the dock, but you said you were involved in anything that went along the banks. But
Yes.
I'm gathering you don't have that kind of, wield that kind of
Clout
review.
Not on the land they own and control, no.
Well, I recall actually walking the distance there with a bunch of legislators, and I guess the Army Corps was still like beginning to be known as the issue. But yeah,
That's changed.
That has changed,
Yep.
for the better, I hope.
Yes.
The entry changed too. I mean, when we went years ago, the entry was kind of like problematic, and now it's like beautiful.
Now, I have a question for you. We were doing water testing it was like, not the last one, the one before.
In August.
It was August, and there were two biologists walking from Profile Falls, and they were from the Army Corps of Engineers, and they were trying to figure out, I don't know, if something to do with, I think it was crossings. Did anything come of that? Were they talking
That
about
may be,
bridges?
that may be associated with the NEPA, but I'm not sure.
I don't know, I think.
The Corps is, we're about to enter into an agreement with them after 20 years or whatever, for a right to use the trail, which will allow us to start construction, but because it's a project on federal land, we need a National Environmental Policy Act Phase 2 study, and they're picking up the tab for that.
So that might.
And that's probably
that could well
what
have
that's
been
related
great.
to.
Good.
I don't know, I also know that they are working to update their master plan, so it could have been
Right,
that
that's-
also.
Good, excellent. I thought it was positive. I said, so where are you from? They said Boston.
I didn't mean to get us off on a
I know,
tangent.
That's
but
okay.
that's a big, huge part of it. I mean, the PEMI is so beautiful. The more people that get to see it and make it work, it's good.
So I just have I do have a question. So you're focused on the PEMI, but to me, the rivers and streams that feed the PEMI are important too. So do you focus on things like the Smith River and the Newfound River that are major contributors that are in Bristol?
Well-
Or do you just look at what's coming out of the end, or do you also work up a little bit, or how does that work?
Well, we can only look at the PEMI. The
Okay.
PEMI has been established, river, but we went to the east branch of the PEMI up in Lincoln.
Yeah.
You know, so occasionally DES might want us to look at something else, but primarily
You're
it's.
focused on just the.
But we do water testing.
That's your
That's our,
charge.
yeah. There's a woman in Plymouth that does the Baker River, you know, the whole Baker River. I don't know how many sites, she got like 24 sites or something like that she does, and has many years of history.
She's
Yeah, and, you know, that, we blame everything on the Baker. You know, if we have pollution down below, it's like, what are you guys doing?
But we do water testing on the Smith, and we do it on the Newfound River.
Mooney Point.
Yeah, but we also, we were looking, of all of the towns that we cover, you have 4 sites that we do water testing, so you're getting a good bang for your buck. And the water has been quite rich.
Yeah, people are really interested.
The little bit that's coming through right now.
Yeah.
It's a good time to do inflow.
Yeah, what do you mean, because it's low? I mean,
Oh, yeah, with the drought.
The drought.
Oh, okay, yeah, we noticed that too, so, okay, yeah. All right. So is it consistently clean throughout, or any issues throughout the river, or does it have sections that are?
It changes, what's really interesting, it changes with the drought.
Yeah.
because there's less dilution.
Yeah.
But it also changes when there's huge downpours and we have these major flooding events where it washes an awful lot of stuff in that
Yeah, yeah.
shouldn't be close to the river.
So let's get back to the baker. When if there's a dam that might, rupture and, yeah. It's
Although we have had porta potties floating down. the
That's
road.
true.
And they didn't come from the baker.
But it has been, it's a Class B, and that's like the kind of designation that makes sure that people can swim and use it for all kinds of recreation. But also, if they treat the water, it would be drinkable. And so that's why there's the committees that do all the testing.
Right.
And the trouble is that like every river in New Hampshire has mercury in it. And that's just a given right now. And now we're also looking at PFAS. And
What's that?
those are the little
Plastic.
Oh,
yeah.
Oh, wow.
Yeah. And that's not a huge problem yet, but it's.
Well, it's
they're
because
there.
we don't know how to test for it.
Yeah.
Wow.
So I'm enjoying this, but I also want to.
Yeah.
Ron has something, so I don't want to shut it down yet, but I'm just letting you know I'm getting ready.
Okay.
Just a quick question. Bill, you had mentioned that a golf course possibly has access for drawing water off of the river.
Correct.
Are there other permitted uses for commercial or residential entities for drawing water out of the river?
Right, there are, and they apply to DES, for their ability to do that. And
Ski areas, right?
And it's, the amazing thing though is we've watched it in the last 20 years has gone very high. I mean, I think in the beginning I was surprised how many there were. I think it was like 30 and 20 years ago, but now it's up in the 80s and close, it was really high. And the sad part is many, like the golf courses, just to name a couple, Owl's, yeah, I'm gonna name it, Owl's Nest has put in a small lake, and they've drained it all from the Penny.
Was that how Lake Harold got filled? Lake Harold up at Owl's Nest? Is that how?
Is that what it's called? I don't know what the lake is.
yeah,
but-
they filled it with a penny, and so a lot of water's just evaporating too, so they have to recapture water. They have a lot of wells too.
Would a residential permit use be someone that maybe wants to irrigate their property? Is that what a residential use of the water would be?
I think they'd have to apply to DES.
Sure.
And I think have controls over it, and also agree to not irrigate when the water level gets below a certain level.
Well,
Yeah.
but again, there's not a whole lot of data on flow rates, like for the whole year, or how long. And now our flow rates are changing so rapidly because of flooding, these huge rains that we come over short periods of time, that it's very good to have this inflow study going on right now.
Yeah.
Thank you for that information, because I wondered how Lake Harold up at Owl's Nest sustained itself, especially with the drought. So that's interesting where the water's coming from.
Yeah.
Yep.
Anyone else?
I don't know if it's appropriate, can I just ask a quick question? Have you heard from Max at all? Do you keep in contact?
So I saw him, I think the day before he took off.
Yeah.
And he was indicating I should go out and visit him. I'm thinking,
Yeah, he's in Utah, right? Correct?
Yeah, so he's out in Utah.
Yeah.
It's Salt Lake City.
Yeah.
I had an email from Helga,
Oh, nice.
and she was saying that it sometimes they feel like they're still in a hotel and they're gonna go back home. But they
Yeah.
enjoy it, and of course, their daughter is out.
Yes,
in-
yeah. Nice.
And they have a beautiful view
Well,
of
that
a
was-
massive
I wanted to
mountain.
say, Helga wasn't all up for it, but Max wanted one up high, which means they have to go upstairs.
Oh,
And I think they have an elevator, but they're on the second or third floor with a wonderful view.
Wow,
And
that's nice.
he said he thinks he can see a river.
I don't normally let people that aren't on the committee talk, but Walter, you're alone, so make it quick, please.
I'll make this short and sweet. Thank you for your service to that river. I remember when it turned White Houses brown.
It was called the Big Stinky.
Did you?
The only quick thing I was gonna say, I don't wanna date myself, like Walter did, but I remember you'd hold your nose as you drove down Summer Street, because the smell was so bad from the Pemmy. And the paint was peeling off of the houses.
Yep.
It was awful.
So thank you for all you do. and-
Well, thank you all for
Thank you.
keeping it working. Thank you.
So I assume you guys are gonna go down, but we're gonna do Transport Central next, so you
Yeah.
guys.
Right.
You want me to stay and support you?
You're over 60, right?
I think it's most efficient to do Transport Central next, so let's.
Okay. And I think Brenda's still on. Brenda Gagne from Tri-County Cap. And we're kind of one of their agents because we're a transportation. We provide non-emergency medical transportation to people over 60 or disabled. So that's basically whoever needs a ride that can't get it elsewhere can call us up and we'll provide them a ride to a hospital or any kind of doctor's appointment, dental appointment. So we are in RCC1, which is the Regional Coordinating Council 1, which is the transport for transportation, and Tri-County Cap oversees us for our purposes of non-emergency medical transportation and the funds that we get from DOT. So we have a service area. We have 19 towns, and we basically parrot what Spear Hospital has for their service area. And and do you want me to just go down the list, or you just? I'll be rapid. As far as the rationale of the funding request, I hope you have. I don't know how much paper you've got, or.
They should have the whole package.
I think we have the whole package.
Okay, so you have our service area, and you have our, basically the 2025 totals by town, and it indicates that Bristol has overtaken Plymouth, and that bothers me greatly, but, because I'm a Plymouth guy, but, so.
Yeah, you're a select board member. I mean, you're a bunch of things, but you're still on the select board, right?
I stepped down.
Oh, I didn't know that, okay.
Yeah, no, I figured that was enough. Well, I just got on their Economic Development Board,
Gotcha.
and I'm really looking forward to that, actually. But so it was, historically, Bristol was relatively low. No, you were down like third or fourth or something like that. Now you've succeeded in passing our highest thing. So based on both the total trips, the total miles, unique passengers don't mean that much because you could have one passenger who's going to make 30 trips, because of their progressing disease or something. So that's pretty much what we come up with as far as like an ask. And for Bristol, it was $3,000. And and it also indicated, gave you all the gross revenues and how we figure out, what we can afford. We've had some increase in our funding because we are taking advantage now of casino monies for nonprofits.
Oh, you got on that list, good for you.
Yep, and the first year we got like 15,000, 14,000, something like that. The second year we got 46. And that, that's great, but it also offset a loss that we just have because we used to be Medicaid. We used to provide Medicaid trips for people that are getting off of drugs, and we basically it was like gravy because Medicaid pays a higher rate, and we would transport people to appointments down in Laconia, Concord, Lebanon, and we'd have like, someone goes to these clinics like 3 times a week or so, or maybe up to 5, and the provider for Medicaid changed, and they did not bring us on board. So thankfully, we have this money that we got from casinos that kind of carrying us. I'm also in the legislature, and what I'd like to see with that money is that for it to go to, I'm sure education is going to eat up a lion's share of that once everything's like done, which will probably be out of that amount of money next year, which is fine with me because we live in Plymouth, so you pay property taxes. And as far as like, we're not asking for any kind of like enhancement for our business. It's just the routine, recruit drivers, get them, get the cars inspected, get them certified. We're all DOT certified, drivers. In fact, I just got back from getting an alcohol test. They require that you also do alcohol testing in addition to drugs. An alcohol test, or you go down to it was like some lab, and it's a breathalyzer, and you don't go down there when you're drunk.
I was thinking the same thing. Why didn't you go down there if you weren't sure you
In
could
fact, the technician said, "Well, why are you doing this?" And I'm thinking, because DOT requires it. And, it's like, it was cheap. It was like a $35 test, but I'm thinking this is stupid, but I don't know.
Well, you mentioned you're in the legislature. See if you can fix that.
No, I am. Because it's also going to get worse. It's going to start to do hair and maybe nails to see if you're ever exposed to some drug. Okay, well, you're still on the road. Those guys are still driving around, but. So, in any event, we're doing okay. We're hanging in there, and we're also, because Brenda's on board. I don't know if she's live or not, but Mike's off. But we're also looking at trying to establish a bus in Plymouth. The best we can do currently is working with DOT to do like a 5310 bus, which is the non-emergency medical transportation for over 60. But ultimately, we're going to be like starting more of a regional. Hopefully, we're going to start like a regional transportation thing. But it's been a few years, been trying, so. But maybe it'll work eventually.
Okay. Go ahead.
What do you use for vehicles? Do you have
Everyone's
a fleet?
own vehicles.
Their own, all right, so
Yeah.
they get reimbursed, all right.
We don't pay them, but we give them 70 cents a mile.
Right.
So,
Okay.
and that's the IRS rate. And people think that that's great. Some people. Other people, like my sister, thinks it's like killing their car, which it is, But if the reason why it's not reportable is because it's a wash. So, but.
Okay. Any other questions? Thank you for coming.
Thank you.
All right, thank you.
That's the problem with being at the end of the alphabet.
We're gonna read it.
All right, well, we'll keep going down the list. I'm sorry, but so, Tri-County Cap, which I think is remote, right?
Yes.
So, if you would introduce yourself and anyone else who's on Zoom with you from your organization, and then go ahead and give us your pitch.
Hi, good evening. Can everybody hear me well?
Yes.
All right, my name is Janae Smallwood. I am the Municipal Funds Coordinator for Tri-County CAP. I see Miss Brenda is on. Hi, Miss Brenda, thank you for being here with me.
Sorry,
I would like to thank...
I'm stopped.
Yeah.
What's Miss Brenda's last name?
Gagman.
Thank you.
Yes.
Did you get that?
Yep, because it's right there.
All righty, thank you. Go ahead, I'm sorry.
Okay, so I would like to take my gratitude to the board for having me speak and also to the town. This year, we are requesting $6,488 in allotted funding. This amount remains the same every year and last year as we calculate our requests using the per capita formula based on the 2020 census. This will never change until the formula does, which is in 2030 census, excuse me. In 2021, Tri-County CAP has streamlined our request to submit one application to municipality, covering all the services that we offer. In the town of Bristol, these services are fuel assistance and energy assistance, housing stability. We also have 211 homeless call response services, USDA, TFAP, food distribution, transportation services, Head Start, and we have our aging disability resources, which some of you might know as Service Link, weatherization, guardianship services. And this year, and started in July, we also have our free diaper program. That is an additional to the community. We also have our community action resource coordinators, which are called CARCs, which we have in every town. We have it in Carroll County, we have one in Coos, and we also have one in Grafton. These ladies, what they do, they go out and speak to the town if the town has concerns, if they need help, they give them the right direction for Tri-County CAPS programs. Last year, we served 237 individuals in Bristol and 113 households with 235 services in the town of Bristol, which was equaling $197,223. The town of Bristol is historic and been very supportive to us, to Tri-County CAP, and we are deeply grateful for the continued partnership that we have with you. I am happy to answer any questions, but however, if I don't have that answer, I can get everyone's email and I can send it to the person that does have that question, and they can email you back. Thank you.
Great. Questions or comments? I am sure that I remember that you were here last year. It sounds like you're continuing to do great work, so I don't think...
Thank you. I appreciate it.
So I don't think we have a lot of questions. You guys, we know you do good work and you're continuing to do good work. So I'll wait a second while you look through that to see if you come up with anything.
Right this minute, I can't.
So I think we're fine. If something comes up in the future, we have your contact information and we'll get back to you. But I appreciate what you do. I don't want to make you upset that we didn't take a lot of your time, but I think we're all good.
Thank you again to the town of Bristol Selectmen. Thank you. Have a good evening.
All right, you have a good evening too.
Bye now.
All right, so Voices Against Violence, it must be you, right? Because
It's us. Yeah.
All right.
My name is Heather. I'm an advocate with Voices Against Violence, and this is one of our wonderful board members.
Yes, my name's Marcy, and I'm also a owner of property here in Bristol.
So, before you go, I know that for lots of people, privacy is important, and I know for an organization like you, it's really important, but for our records, unless you really object, I'd like to get your last names.
That's fine. I actually grew up in Bristol. Half of you know me. It's Heather Huckins.
Okay.
And I'm Marcy Gowan-Nobley.
We just don't use I don't use last names during my day. I'm so used to.
So I don't want to cut you off, but I just found, so I have a niece who is like 21. She's a student at Northeastern, and she has a co-op where she's working. And I was talking to my brother, and he's like, yeah, she's working in a place where people who've been abused are sheltered. We don't know where she actually works. We know where their headquarters office is, but she's not allowed to tell us where she works because that's not public information.
Yep.
So I understand privacy is important.
Appreciate that. We have a confidential shelter as well that
we won't ask you about that.
No one knows about me. I would like to say, you know, I'm sorry that our executive director, Tina Malevy, could not be here tonight because she speaks way better than I do. She knows all the answers and I don't. But unfortunately, you know, I'm feeling things come up.
Yeah.
So thank you for having us. I would, I believe we asked for $10,571. Feel free to make it a round number.
As long as it goes up.
Scott, that's only if you round up.
I don't think so. I have written down 10,256.
There were two different numbers on the document that came in, and so we put the lower of the two, but if you need to change that, so if you look, there's two different numbers. There's one on the cover, that's one number. I don't have them in front of me, sorry.
On the cover of this one?
The letter?
There's that.
In the letter, there's one number.
You know everything, so.
No, not really. No, I can't find it. So this says 10,256.
Okay.
But the other one says a different number, so.
Okay.
So.
I'm gonna go with whatever you wanna know.
We did not know which number to put in, so the 10,256 is what's in the system.
Okay. Well, I will leave that with Tina.
Okay.
I don't know anything about that.
I'm sorry.
So I know that Tina had shared, so there's a kind of a cover letter that talks in general about what Voices does. We're one of the 10 crisis centers in the state of New Hampshire. We have our office is out of Plymouth, primarily. Someone asked me in Alexandria. I think, so the court's there. One of the things that we do is we respond to court. They call us and say we have somebody down here, and so we can get there within 4 minutes to help somebody with a protective order or whatever it happens to be. But we do serve 21 towns all the way from Benton and Easton, and actually Bristol, I think, is the kind of the bottom of our catchment area. We go to Warren and Wentworth and, to the other side, Holderness. So we also had, so Bristol is our second highest utility use. Thank you. I do direct service. So I believe, so Tina provided that as far as the breakdown of all of the towns, but Bristol certainly is a very important part of our catchment area. A little information, when I first started, I was what's called a roving advocate, so I had the pleasure of being stationed at Midstate in their offices one day a week. So I could be there, and certainly, and there were occasions when, somebody, one of the providers would say, I have somebody in my office, can she come and talk to you? I'm like, absolutely. It continues to be a safe and confidential place. We work, domestic violence is a hard thing. People get isolated, don't have transportation, the abuser will give enough gas money just so that they can go pick the kids up at school, go to the grocery store, whatever it is, get receipts on the way back. They can't go anywhere by themselves. So Midstate has been great because we will work with them, and I can go meet somebody. I'll be in a room, they'll come in for their doctor's appointment, and that way they can come and actually talk to me, and we can help them through, again, whatever they want to do, whether it's safety or planning to leave. So, strong connections, which is wonderful. So I would go and visit, the PD, and it's great. I have Chief Bean's cell phone number, which is, it's just kind of nice if he has something that he's concerned about. If I have something that I'm concerned about, because I'll go to the PD and sit with somebody if they want to report. Detective Schaffner, one day, he had somebody who came in and wanted to report something, and he called and said, I've got somebody here. Sergeant Henry worked with, so it's nice to have that good relationship where I can also call up and say, hey, I'm working with somebody, and they wanted me to ask you this. So the relationships are very important. So we also do, I'm also the person who answers the crisis line calls. So we are continuing to try to save money. So we have, instead of giving money to an outside crisis line to answer the calls for us, call us, and then we call back, we implemented a new technology where the crisis line basically comes to whoever's on call. So it's kind of so that it has saved us money. We can still get back to people as quickly. We will also accompany people to the hospital, whether it's for a domestic violence, and so they're there to get medical support. I also, one of the places that I cover is Florida State University, and unfortunately a number of sexual assaults. And so we'll actually go to the hospital and work with the SANE nurse, like they're amazing in Spear, and be with them during the entire time and just support through that and after. And if they want to report, we work with the local prosecutors, the Grafton County Attorney's Office, sit in on meetings and interviews. We had somebody call this week. They were fleeing a domestic violence situation, and we don't have a lot of money, but we had enough. We were able to put her up in a hotel until she could get to a safer place. We will also do things like if somebody wants to get out of state, we bought bus tickets to way far away. We'll do car repairs, if we can, help out people with, like kids, like somebody, right, they flee, they take their kids and their dogs, like, we buy dog food and all of those things. So that's kind of what goes into, the money that we spend. One thing, domestic violence is hard, sexual violence is very hard. One of the things that, so we will help people get out of their situation if they want to. But what's sometimes hard is sometimes it's safer for them to actually stay in the situation. Just talking with somebody this week, left, but now animals are being tortured, which is just terrible to try to get them to come back. But we will work with them on what's safest for them and what they want. This is it's not something anyone wants to talk about. It's not glorious. But I'm so glad that we are able to be a confidential place that we believe people. Somebody else I just talked to today said, you were the first people to believe us. You were the first one. And now she's working through the court system and trying to keep her children safe when the children have not been safe with their dad. So it's hard stuff. So we appreciate all of the support that Bristol has given to us in the past, whatever you can give to us, and we're glad that we can support the community and with the safety in a place for people to come. So thank you for having us.
Questions?
No, I think it's great. And that's all. No, I think it's great. That's all.
Buzz, go ahead.
I've got one. I'm not looking at the letter. I'm looking at another document that was provided, and it's talks about rationale for how the funding request is calculated, and it says that all towns get a base contribution of $2,000, and then a small additional amount that reflects the 2-year average number of residents served. And our small additional amount is $8,500. Does that mean that we're a hot spot?
Yep, you're number 2 behind Plymouth, like by far.
Swell.
Unfortunately, yeah.
Yeah.
I have a couple. Do you have, or is there, it's safe to assume it's probably one demographic that's using your services? Is there, or is it multi-age, multi-gender?
Multi-age, multi-gender. It's not as many males, just because if you look at the national average, you know, when you're talking domestic violence, it's just predominantly, you know, men are abusing against women. We have worked with men, like I have worked with a man who was being abused by his wife, but it's just not that many. I think we also get underreported sexual assault from males, but we have, you know, I worked with a couple, so I think they're starting to maybe speak out a little bit and reach out a little bit more.
And then, second question, go ahead.
But we, like income distribution doesn't really matter. Like I have worked with some wealthy people, you know, and we're talking getting, you know, multiple houses and this and that, and some people who leave when they're younger. And I have worked with ladies in their 70s and 80s that have been married 40, 50 something years. It's all over the place. Thank you.
And then part 2 is, do you have other contributions coming in, or do you fundraise?
Yes,
Yeah. So I sit on the development committee for Voice Against Violence. So we have grant funds that come in. As you know from everyone else who has talked today, all of our funding is cutting short. So we do Dancing Under the Stars here in Bristol, which raises a little over $10,000. We've done it for 4 years now. And that has not only brought the money in for fundraising, but also awareness. I think that when I first moved here 10 years ago, I don't think as many people might have known about it. So I think that us holding the event here has definitely brought education to people. We do that. We do an annual ball every year that raises over $20,000 there. We've started to do cornhole fundraisers. So we've done those. And then lastly, we just, like someone had talked, we just got the casino. We got chosen for one of them. So November 17th to I think the 26th, if you're over in Lebanon, drop some money there. So this will be our first year doing that. So.
Okay. Are there other chapters in the state, right? Correct?
Yes,
okay.
correct.
All right. So my company is
like
involved
us?
down in Manchester, so, with Voice Against Violence. So,
Yeah,
but
so-
just a different chapter, I'm assuming.
Yes.
Yeah, we are.
Okay.
We all have different names. I think Reach is now in Manchester. It used to be the YWCA, which is where they were out of. So they cover Manchester, and so there were 10 crisis centers that cover the state.
You cooperate to hide victims?
Oh yeah, yep. And so one of those. Not everyone has a shelter. We have a shelter. Ours is a highly confidential shelter. Some are a little bit more open. But for example, if we were to shelter somebody from our area and they were to go grocery shopping in Hannaford and they were to go to Walmart, you know, they're more likely to see their abuser in those places. So we generally are going to shelter, you know, our clients someplace else, and we're more likely to get clients from other areas to come into our shelter. Yeah, so we cooperate a lot. I have somebody going to court, you know, in Lebanon, and we work together.
Do you share resources from your fundraising, or is it your fundraising just strictly for the Swinging the Voices Against?
Just strictly for
Just
voices.
strictly for-
Yep.
yeah, okay.
And then the grant funds, depending on how they come in, it might be state
Yeah.
funded, and then they distribute based off of how many victims we might see or
Right.
how many we've served.
Right,
And I know that Heather kind of talked about the hard part. We do a lot of education. And it can be, I will say that I had to talk to Voices Against Violence about my daughter. She's only 6, and we had to have a hard conversation. And it was just a conversation. Like, how do you actually talk to a 6-year-old about something that might have happened? And it's just amazing as a parent, just having that conversation, because I had no idea. How do I actually talk about it? So I will say that that's one of the things that I think Voices Against Violence is a part of, is just educating people as to how to have those hard conversations and how to have them with a small child, with any age.
Right.
And that's what we're here for. And I think that's one of the reasons Dancing Under the Stars, being involved in Bristol, has allowed people to really reach out to us. So,
Thank
definitely.
you, Marcy.
Yeah.
We do have a training and outreach coordinator, and so she actually will, she'll be training at police departments. She does judges training. She also, will go to, at schools. She'll go into the schools, like to talk to the little kids, and she's very good, she differentiates
Exactly.
the language between who she's talking to, but that also gets that awareness out there. Why do we have bigger numbers? Maybe people feel like, okay, there is somebody out there who will listen to me, and I met this person and said, oh yeah, that's happening to me, and I have someplace to go.
Yeah, and it's something as little as they taught me just respect. Like me saying, like if Heather says, Marcy, can I use a pen? And I say no. Well, you have to respect my decision because I said no. And that's how we start that process. So I definitely think that Voices being involved is helping.
Go ahead, Brian.
In your work, have you been able to identify the causes that the abusers are propelled to do this kind of activity?
No, I wish I could. Here's what I frequently say when I'm working with someone. Like, if we knew why people did this, it would stop, right? They could be stopped. There's a batterers intervention program that's run by, I think it's run by Grafton County, but it's voluntary, and somebody has to. It's like a 32-week. I don't know. It's long because I was a little surprised when I went to a conference, because you think like you were abused as a child, and so then you grow up and then you abuse somebody, which is not surprisingly the numbers don't bear it out. Sometimes what'll happen is adolescents will kind of have somebody take a change in how they approach, again, usually become more like a sexual predator, something like that. So I often think I'm gonna go back to school and I'm gonna do my thesis on, why do people abuse? These are, I was just talking to one of the state troopers the other day, and he said, oh my God, Heather, we have this guy who does so much wonderful stuff for his community. He is like the best, and he's like your dad, and all that. And we find out, somebody finally called, he got arrested, he has been, he's like one of the worst abusers. I'm like who knew? These are pillars in our community that you think, no way, they're the nicest person in the universe. And they can also be people who are, hard on their luck. Or whatever, but there's, you think you can. Thank you for the question.
Anyone else? No? Okay. Well, thank you very much
Thank
for
you.
coming
Thank you
and
so
sharing.
much for everything that you do.
Thank you.
Next year, have the river come
Do
after these
Z
folks.
to A instead of A to Z? Is
When you first up.
It all worked out because Alexandria was tonight too, so.
Oh, you got to go there
I
first.
went over there.
All right.
We got done, so.
Good. All right, I'm glad that worked.
Thank you.
Sure.
You too.
All right, so one of the things, before we move on to the next, I just want to put it on in your thoughts. So we sent out basically invitations to all of the groups that had contacted us last year, including some people that contacted us and basically said, we don't need any money, or in the case of Day Away, I think they even told us that they've stopped their program. So we've got a couple of people right now that have not asked for funding for now at least 2 years in a row. I want to put a bug in your ear. I think at some point, it doesn't make sense to keep sending them requests. So I'm not making a motion, but I think that when we get in mid-November, when we go through this and actually approve the money, I think I'm intending to just see if the committee agrees that if you've gone 2 years without responding or asking for some funding, we'll take you off the list. If later on you want to get, then you have to take the initiative to come to us.
Right.
Just want to share that thought with you so that you can think about it and think about whether you agree or not, so when we do discuss, you don't get caught by surprise. Okay? Next on our agenda is to approve the minutes from our last meeting, which was back on April 15th. So everyone crank up their memory. I know I had to, and proofreading the first draft of the minutes. So has anyone who's had an opportunity to review them have any changes they'd like to propose? Hallelujah.
I read them,
I didn't
Wait a minute, there are no changes, no edits, no nothing?
I went through it with my usual
Oh my.
Microsoft.
Good job, Sharon.
Nope.
Anyone else?
I worked really hard on that.
So what happened on the other times?
Twice.
I don't know, I was working hard with those too, but.
I think I dropped the keys.
Oh, yes, no? I see a
Some
bottle.
newspaper.
And a newspaper.
Maybe I left them in my car. Uh-oh. So,
We'll go up, if
Do you
we,
have a code?
you have a way to get in your car?
do I wave?
Oh, yeah, okay. We'll come back
I
in.
have a phone and my husband can use it.
All right, well, if you need some help, come back in, please.
All right, thank you so much.
See ya.
All right, not hearing any suggested requests. Someone want to make a
To
motion?
approve the minutes.
Second.
Motion by Les, seconded by Buzz. Any discussion? Not hearing any discussion, all in favor?
Aye.
Opposed? Abstained? Abstained, right?
Yeah, I wasn't here.
Okay, so 5-0-1, minutes are approved. The next item on our agenda is correspondence.
Excuse me.
No, not making a motion. Does anyone have any correspondence they want to share with? I mean, obviously, all of the correspondence with the outside agencies, but I was thinking, anything else going on?
I think you have a thank you, but I forgot to bring it, so I'll bring it to your next meeting.
Okay,
Question on the abstentions.
yeah?
Someone abstaining.
I did.
Everybody was there.
I was not.
Yes.
No, he wasn't the rep, was he?
I
Pardon?
was not the rep. This is my first budget committee.
Oh,
He wasn't
so
the
you
rep.
were not recommending?
It doesn't matter, even if he was here, he is allowed to abstain, so he
Okay,
abstained.
no, I was just not really accurate.
I wasn't gonna worry about whether you were here or not, you abstained, move on. All right, that's me. I'm trying to think, well, I guess I should admit, because I talked to Sue. So Sue had sent me a correspondence and asked some questions about, I think it was primarily about funding models, and in particular with the home health agencies. And I completely dropped the ball. I think I drafted a response and then stuck it in my draft folder and never sent it. And I also had a request from Walter to let him know when the meeting was going to be. I found that in my draft folder too. So they're kind of correspondence, but I've already apologized to Sue for dropping the ball on her request, but I don't think it was a crisis, so but I still feel bad about it. I think that was it. So not hearing any other correspondence, let's go around the room. Typically we start from the select board, anything going on with the select board that you think we need to know about? Or that you
Just
need to ask us
that
about?
I've been in this room since 9 a.m.
Yeah,
And so we got through all our department heads today and made notes, and we will approve our budget on Thursday, correct?
Thursday, yes.
So we should be passing on our budget to this committee next
Tuesday. Right, that's what I had, that's what we built into our schedule, and that's what I showed up to earlier in the year to the select board, asked them to commit to meeting the October 21st deadline, which they agreed to, and they're on track for it.
So heads up though, I will probably not be able to get, either Shannon or I will not be able to get that budget out to you until late Friday afternoon, because I have to turn it around in 2 days to the board Thursday night, and then I have to turn it around again by Friday afternoon, so it won't be coming to you until late Friday, so for your Tuesday's meeting.
So earlier today, Shannon did resend the meeting schedule. So if for some reason, I thought everyone had it, but that wasn't clear, so we resent it. I'll just share with my point of view. I was not expecting to do a ton of study on the budget before next Tuesday. So the fact that it's not going to get to us is not, to me, a problem, because what our schedule, in my mind, says is we're meeting on next week on the 21st, where the select board's going to present their budget and the CIP committee is going to present their plan. Then we're going to meet again on the 28th, which is a general meeting to talk about the budget and what are our goals and what are our procedures and what are our... So we all need to look at the budget before that meeting on the 28th, but we're not going to vote on anything. I don't think we're going to hold anyone's feet to the fire about what's the detail in the budget next Tuesday. So
As far as the budget goes, it's pretty lean. I mean, it's generally across the board, we decided to go with the 4% COLA. And all the department head, all the budgets are pretty close to that, except for one. So, other than that, there are no major projects per se to speak of. CIP is a little higher, making adjustments for inflation and cost of goods increases down the road. But other than that, there's no surprises, nothing hopefully this year, I think will be pretty easy process.
No major projects in the budget, but of course we haven't started warrant
Well,
articles yet.
but there's some warrants,
That will be later, but.
Nothing major.
Nothing major, but.
Any known losses of revenue?
Losses of revenue, no, so
We're
we
not
put,
anticipating anything, are we? I don't think so.
the only, well, only if
Yeah.
the SAU buys the bank, but that's got pushed off until March. So they're not having a special meeting.
The only
Oh,
other,
and then,
go ahead.
yes, the county courthouse. Well, no, that's not a loss of revenue, but that is a major project that could affect us down the road.
Share. Loss in revenue, the only thing that we're not sure how it's going to affect us yet is going to be ambulance and Medicare reimbursements. There's a law that went before, statute that changed, and that could affect how our ambulance billing will be. We just don't know the impact and how it will affect us yet. But that wouldn't be until next year, so.
But our new finance officer is working diligently on getting revenues out. There's been an illness going through the office, so. But
Last year, it was unanticipated, the difficulty the school system that caused the tax rate from being set in a timely manner. Is that, as far as you know, is that all sort of leveled itself off?
So we will be late tax rate, but right now that is being attributed to the town revaluation, because that's in process and that isn't going to be closing until mid-November most likely. So we won't be setting the tax rate mainly right now because of the town. Our understanding, and Paul Harris will be here Thursday, our understanding is that they are, they've had their audits done, they filed one of their missing years, and they're working on the next one, and they're anticipating to be able to go with their side of the documents in time, once we're ready for them, once we're ready to go forward with the reval, with the tax rate setting, so we're the one that's holding it up this year.
Okay.
Yep.
I think that's it.
Okay, thank you, Scott. Buzz, anything you wanted to comment
I
on?
just would note that I thought
Sorry,
that the
Scott.
quality of the submissions this year from the nonprofits and whatever, that they seem to be getting better at it. I didn't go back and look at prior years, but it just seemed that there was more detail and a little bit more explanation.
I would agree with you. I think we made some effort over the past 2 years to tighten up our, not just let us know if you want money, but we told them we want specific information. We want to be confident that you're doing good things for the town and deserve it. So we've asked them for more detail, and they've done a good job following through and providing that detail.
Right, and also the Bristol part of things too.
Oh, we made it clear. We didn't just want to know about Grafton. We wanted to know specifically about Bristol. What are you doing, not just for the world, but what are you doing for Bristol and its
And just
community?
one more thing,
Go ahead.
I'll reiterate that next year, don't put those people last. It's just so depressing.
I know. We'll make a note to flip the order.
Okay. Les, anything? Brian?
Nope.
Nope, we got nothing.
All right. Christina, anything from you?
No, I don't think so.
Shannon, anything you wanted to say?
Nope.
Good job on the minutes.
Okay.
Yeah.
So, we will, that's gonna be interesting. So we have a meeting, I'm just thinking out loud, which you guys know I do. We have a meeting in a week, so we have a fairly turnaround. I don't wanna get into details. I actually have a bit of a family thing going on, and I will be leaving Thursday afternoon to go to get together with family to try to deal with a problem that has come up. So, do you wanna give a try at handling the reviewing the first draft of the minutes?
Huh?
I'm just concerned that I'm gonna be out of town, and I don't know if you might, if, I'm not sure that we'll get them out, if I'm the one who's proofreading them, I'm sure we'll get them out by Friday. Certainly can do it over the weekend and come out on Monday. Do you
Well,
want-
when
do you
would you
want-
do it? What days would you?
Probably you'll send them out on Thursday?
But more than likely, I'm gonna try to do them within the next 24 hours.
Okay, yeah.
If you don't want to do it, you don't have to, but if you're willing to.
Yeah.
She sends the, so typically she sends the first draft to me. I proofread them,
Okay.
and I don't do it as well as Buzz, but I'm looking for grammatical errors. But I'm also looking, more importantly, I'm looking for, are there any information that either is misstated or missing?
Right.
And then, after you give that after I give that feedback, or you give that feedback, then that's updated, and then it gets sent to the whole committee, so we discuss it at the next meeting.
Yeah, no, I could do it, sure, she could send it to me.
Okay, so send it to Sue instead of to me?
Okay.
Thank you. Great. Anything else, or are we ready for a motion to adjourn?
Motion to adjourn.
Anyone want a second, Leslie?
I'll second.
I'll take, so motion by Les, seconded by Sue to adjourn, all in favor? Aye.